procedure, we have to know about the ECG machine or ECG instrument, that how it's works. So here we are going to understand the ECG procedure or ECG machine, that how we will do procedure or ECG through this machine. As we learn ECG through academics, but our teacher Ma'am is going to do ECG on me so that student will understand it, and after that student will perform ECG. So here I start ECG on my friend as well. He's my classmate too. His name is Shayan Ali. So listen carefully as well, look carefully to the procedure so that you will understand that how ECG procedure is performed. So here I am putting some sort of gel on his body, on the spots where we have to put the ECG points. This gel is a specific gel which is used for the electrolyte or electric waves, through which waves can pass very easily and with a very high quality. Means it's something like a conductor. So here I am putting gel on his body. He's confused as well, he's feeling shy too, because it's his first time and he don't know that what is going on. Now I am putting spot on his hands. There is a formula for the spots. We have RYGB. RYGB. R mean red, Y mean yellow, G mean green, and B mean black. So red for the right hand, yellow for the left hand, green for the left foot, and black for the right foot. So I put the clips on his hand as well on his feet. So here I am going to put cables on his chest where we put the gel. So now I am going to find C1. C1 mean cable 1 of the ECG machine. So here I find it, and now I am going to put it on the fourth intercostal space. Intercostal space are the space between the ribs. So the spot of the C1 is fourth intercostal space. Now I am going to put C2. So C2 is just parallel to the C1, mean just between near to the sternum. We have to put C1 as well as C2 near to the sternum. After that we have to put C4. Now we are going to put C4. We will put C4 on the fifth intercostal space, which is just below the nipple. So here I put C4. Now you will confuse that where we have to put C3. So it's very easy. C3 we have to put between the C2 and C4. In the mid of C2 and C4 we have to put C3, mean cable 3. Here I put cable 3 just between the C2 and so it's very easy. C3 we have to put between the C2 and C4. In the mid of C2 and C4 we have to put C3, mean cable 3. Here I put cable 3 just between the C2 and C4. Now after C4 we have to put C5. C5 we have to put C5 between C6 and C4. So between C6 and C4 we will put C5. So now you will say that where we have to put C6. So C6 we have to put on the mid of the scleratus line. So here I am going to put C6 on the mid of the scleratus line, and here I put it. So now our patient is ready for ECG. Here I am going to start ECG. As for doing ECG, first of all we have to know about the ECG machine, that how it's turned on, how it's turned off, how it's work. So now I started as my machine is preparing the system. Almost it's prepared as I on the machine, and now it's just preparing the system. Yeah, it's prepared. My machine is ready to ECG. Here I'm looking instructions. So here I look instruction that how to start a machine, and here I press a button and my machine gets start. So here I look instruction that how to start a machine, and here I press a button and my machine gets start. You see the page coming out from the system, it's ECG. The main thing in electrocardiograph is this page. In this page we know about the heartbeat as well about the waves through which we have to discuss the problem of patient. as we perform ECG. After performing ECG, here we have to write the name of the patient on the ECG paper. As well, we have to write the ID number, ID card number. After that, we have to write about the disease or about the something like disorder of the heart which we saw or we object in ECG. So here we are going to write the disease, as well as we have to prescribe some sort of medicine to the patients. So it was all about ECG, that how ECG is performed and what is procedure of ECG. At the end, I would like to take permission from you guys. Stay happy, stay tuned, and stay blessed. Thank you so much for paying attention. Goodbye.